rheumatoid arthritis and osteoarthritis. Hey guys, welcome back to my channel. For those of you new here, I'm Dee. I am a nurse who has worked in rheumatology as well as a rheumatoid arthritis patient myself. I make weekly videos on Thursdays about rheumatology, health and wellness. So if that is something that is interesting to you, make sure you hit the subscribe button and then hit the little bell so you don't miss any of my videos. So today I wanted to talk about the similarities and the differences between rheumatoid arthritis and osteoarthritis. Let's start out with the similarities. The most obvious one is that they both are a type of arthritis. They both have to do with joint pain and stiffness and joint swelling. Another thing that they have in common is that some of the treatments for them are similar. You will see some people take Tylenol or some sort of NSAID like ibuprofen or Motrin, Mobic, Celebrex to treat joint pain. You will also see people recommend physical therapy or occupational therapy to help maintain strength and to also help treat some of the joint pain with movement and getting up and getting around. As a last resort, there's joint replacements for both of them. If they're not controlled or treated, they can lead to disability. It is a very debilitating thing to deal with, and they have a chronic, gradual process that it goes through. And with both, you can experience flares, which is when they get temporarily worse with your symptoms, as well as just progressively getting worse, so the pain gets more severe or it moves to a new joint. And with both of them, there is some irritation and inflammation going on, so anti-inflammatory foods can help with symptoms with that. The last similarity is that both of them can be treated by rheumatologists. And with that said, let's go over to the differences. So we're going to start out with the rheumatoid arthritis. That is an autoimmune condition. The arthritis and the inflammation is caused by your immune system attacking the joints. Osteoarthritis is caused by the wearing out of the cushion between your joints and bones, not an actual immune system attack. So because they're caused differently, they have different treatments for them. So for rheumatoid arthritis, you will see a lot of DMARDs. So that's like your methotrexate, your Celcept, your sulfasalazine, Plaquenil, Immuron. You'll also see your biologic medicines like Humira, Enbrel, Remicade. Those are not medications that you would see treated for osteoarthritis because osteoarthritis is not an immune system issue. It is a cartilage breakdown issue. Rheumatoid arthritis also can happen at any age. The average age seems to be for people in their middle ages, but it also happens in the childbearing years. A decent number of women get it after childbirth, and then also children can get it because it's an immune system going awry. Osteoarthritis, on the other hand, while you can get it at a younger age, it tends to happen with joint use over time, which is why a lot of the times when you see people with osteoarthritis, they're usually in the older category. Another difference too is that osteoarthritis is something that you can help prevent, so it either doesn't happen at all or it doesn't happen till much later, versus there's some sort of trigger that just triggers your immune system to be like, I'm confused today. It's not as preventable. Another difference between rheumatoid arthritis and osteoarthritis is that rheumatoid arthritis will go beyond the joints. It is called a systemic condition. So if it is aggressive enough, it can and will go and attack other organs as well. It can irritate the lungs and cause interstitial lung disease. It can contribute to heart disease that is very common with people with rheumatoid arthritis. It can irritate our vasculature, so that's your arteries and your veins, and it can cause circulation type things. You could get numbness and tingling. It can attack your eyes and your salivary glands. You can get additional autoimmune illnesses. It can attack so many different organs beyond just the joints. Osteoarthritis primarily impacts the joints. It can spread into the muscles in that if your joints are really painful and you don't move it, you can have muscle weakness, but it doesn't move to other organs the way that rheumatoid arthritis can. And another big difference between the two is that the medications that are used for rheumatoid arthritis tend to be specialty medications. Beyond your ibuprofens, Tylenols, Aleve, beyond those type of medications, a lot of the medications that are used to suppress the immune system and calm it down are specialty medications, which would require specialty pharmacy or going to an infusion center. I did hear about a new treatment that has recently come out that has shown to help with osteoarthritis. That is an injection. That said, because it's still new, I'm not quite sure if that is like the standard treatment for osteoarthritis at this point. That about sums up the similarities and the differences between rheumatoid arthritis and osteoarthritis. So I would love to know your thoughts, your feedback. You can have both at the same time. So with that said, I will see you guys in the next video. Bye.